Welcome to Next 2019 in Chicago. I'm Jason Bellamy, and we're getting closer to wrapping up what's been an amazing conference already so far. And one of the sessions happening today is being led by Sally Taylor, who's joined me. Thanks you for being here.
Thanks for the invitation, Jason.
Yeah.
It's great to be here today in my hometown of Chicago, Illinois.
Yeah, so you work nearby. First of all, share with us where you work.
Yeah, so I'm actually a therapy manager at the Shirley Ryan Ability Lab. I've been there for 17 years now. So I went through the transition when it was the Rehab Institute of Chicago, the move to the new building 2 years ago, and moving into the future with the organization. Very excited.
I had the pleasure to tour that a couple days ago, and it's just a tremendous facility, and you guys do great work there. So I'm glad to have you here.
Wonderful.
Your session is about social capital in healthcare. And so let's just first talk about social capital, what that even is. Just give me a basic definition of that.
Yeah, so social capital is really the connections that you have between people and how you can really leverage those relationships to get a better outcome. So in the context of healthcare, you know, there's a lot of talk about teamwork and patient outcomes. And at the end of the day, it really boils down to how effectively are teams working together, collaborating, and really establishing beneficial relationships.
So how did you get interested in this topic in the first place?
Yeah, so that's a really interesting story. I'd love to share it. My husband was actually getting his MBA at the University of Chicago Booth School of Business, and I had some free time, so I signed up and took a class with him. So a full trimester, the course was strategic leadership, and we went through the whole topic of social capital, more than what I'll condensed down to the 90-minute session this afternoon, but it's really fascinating about, you know, there's a whole science and research literature from the sociology and business perspective that we can kind of bring over to the healthcare arena. It's really kind of an untapped bridge, kind of building on one of the forms of social capital.
So let's go through some of the highlights. You talk about there's sort of 3 network forms of social capital, and if you can kind of walk me through those and explain how they relate to healthcare.
Yeah, so at a high level, a broker network is really like, how do we create value? And this is where new fields have been discovered, where maybe individual that has a different background talks with and collaborates with someone else with a diverse background, and they come up with something totally new. So it's where a lot of new innovations actually come into play and new value to organizations. The other type of network is really a closed network, and that's really just kind of getting down and dirty. How can you really be as efficient and effective? And a good example is back in World War II, they had the Liberty ships. They went from, you know, making ships in hundreds of days down to like 42 days. So really being efficient, and that's another driver in healthcare, is like, how can we really be as effective with the resources that we have to be as efficient as possible? And then the final one is a partner network, and that's really like, how do you maybe tap into people that have some experience in a different area and really leverage to kind of move into different domains. Off the example might be moving it like a new restaurant into a new environment that maybe never had a Kentucky Fried Chicken. You know, that's not exactly healthcare, but that's really how that partner network moves forward.
So let's say I'm a PT, I'm a PTA, I'm navigating healthcare. Why does understanding social capital help me?
So it really goes down to the National Patient Safety Goals, and one of the goals that's been written by the Joint Commission is really about communication. And when you think about communication breakdowns, it really at a fundamental level is, how comfortable am I with the people that I'm working with? How well do I know those people? And being able to develop those relationships is really where social capital can really kind of help to move our profession to establish those, not be afraid to approach and tell another healthcare provider, I saw this red flag in my session. Can you follow up on, you know, the next step? Maybe it's a little bit out of our scope, but really, you know, helping to work more cohesively as a team. And that's where social capital brings more of a research perspective to kind of more of like a non-tangible skill from the perspective of, you know, we're always thinking about outcomes. This is a new outcome in the field of communication.
How do you grow that? How do you build that muscle? How do you grow that skill?
So I think it really just starts with a really fundamental, like, are you talking to the people that are around you? Like, when you're in the elevator, do you talk to that person? Like, do you know what the name of your housekeeper is on your floor? And, you know, when we come to conferences, it's really important to network. We've heard that a lot throughout the week this week. But even just taking it that next step of how are you, you know, connecting with those people that you're talking with. And it's more than even just the other people doing research, it's everyone in the whole hospital and how that's going to really move the organizations in the future.
So anecdotally, we'll hear sometimes from physical therapists who say in our large healthcare system, and they don't feel they're getting the referrals through the health system that they should be. They feel they can help more patients earlier or in more cases than they're getting there. And often what we hear when we sort of challenge, what have you done? It's sort of like, well, nothing. Like they assume somebody's going to solve the problem, and they haven't initiated those conversations. So if you're understanding where you are in that space, if you're building those relationships, how do you start those conversations, right? How do you advance beyond your bubble and get comfortable, maybe going up the ladder and trying to build those relationships so that you can start to have conversations maybe you weren't having before?
So I think it's really just, going out of your comfort zone. It's really, I work in a high-rise building. I ride the elevator probably 25 times a day. I try and talk to whoever's in the elevator with me, and it starts with, then you see them the next time, then maybe your conversation's a little bit more deeper than what's the weather like outside. Oh, what department do you work in? Oh, what's your specialty? Oh, that's interesting. You're working on this project. And, to the point of, how do we increase the referrals globally? It's taking that into the community. Like when you're at the grocery store, are you talking to those people that future, the person that's ringing you up at the register, maybe she doesn't even know what physical therapy is, and she's been having pain, for months on end. And maybe you tell her you're a PT. Oh, wow, that's interesting. What do you do? I help people with, pain management. So it really just starts with those conversations and, kind of taking ourselves away from, being afraid to say something. And
being afraid to tout what you can do, right?
Right.
So you mentioned, you got interested in this with a sort of a deep dive in a course. How much does someone need to understand about this to sort of start to build that muscle, to make that progress? If somebody couldn't be at your session here today, where would you recommend they go if they sort of want to increase their knowledge on social capital?
Well, there's a few references. There's not a few. I actually did a literature search in the field of healthcare. There was only 2 articles. There's some researchers down in Australia. But to just get started, you can just Google what social capital means, and just kind of take the first steps in, starting those conversations, introducing yourself to people, remembering the names of the people that you're meeting, say hi to them the second time you meet them, and just be curious to get to know them. Because, they may have a talent that's really going to help move your program forward, and being able to tap into that and help them to be successful, and then in turn help your initiative to be successful. It's really about the partnership and, growing it and ultimately helping the patient outcomes.
Be curious is always good advice. We've got people here at Next who are curious, who are learning new things. Sally Taylor, thank you for being here.
Thank you for the invitation.
I'm Jason Bellamy, and we'll catch you later.